So in terms of good cholesterol, bad cholesterol, what should we be eating? What shouldn't we be eating? I mean, this is going to be very confusing for a lot of people, because there must be lots of viewers out there who are on statins, who take statins regularly, who have been told absolutely black and white by their doctors, no, you need to be on this. You need to be on this because your health indicators are not good. And you're saying, no, that's wrong.
Well, not completely. So I think there's two different discussions here. One is about lowering cholesterol for the sake of lowering cholesterol, either through diet or drugs in general. And we know that doesn't really have much of an effect. Now, statins do have an effect. But as I write about in the book, A Statin-Free Life, which I just published, the effect of statins is likely nothing to do with lowering cholesterol. They also have the properties of being anti-inflammatory and anti-clotting. But even when you break that down, Alex, the actual effect is very, very small, much smaller than what people are told or what they realise, much smaller than even most doctors and general practitioners probably realise as well. So just to give you some context here, if you've had a heart attack or you have heart disease, then a statin, taking it religiously over 5 years, if you completely trust the industry-sponsored data, because that's the other problem, all of this data comes from drug company-sponsored trials, but let's just say that we accept that as gospel truth, then the absolute benefit for an individual is 1 in 83. So 1 in 83 of those people who've had a heart attack will have their death delayed, or it will save their life. And 1 in 39 will have another heart attack prevented over 5 years. Now, that's in people with heart disease, a high-risk group, if you like. So there is some benefit there, although a lot of people probably think that's smaller than they would realise. And then if you look at everybody else, which is actually most of the people probably in this country and around the world taking statins, there is no prolongation of life expectancy. You're not going to live 1 day longer. And in fact, there's about a 1 in 100 chance that will prevent a non-fatal heart attack or stroke over 5 years. So what I'm advocating for in this book is make people aware. It's about informed consent. It's about ethical, evidence-based medical practice. So, what we should be doing with patients is having an informed discussion. We call this shared decision-making. And then let the patient decide. Sometimes the patient will decide for themselves, and sometimes they'll say, Doc, I'm not sure, what do you think? And that's fine. But at the same time, we mustn't neglect the lifestyle, because actually when you look at heart disease, and that's obviously